And the percentage of Ohioans in poverty rose for the first time in a decade, according to a report out this week. The 30th annual State of Poverty report says in 2021, 13.4% of Ohioans were in poverty, up from 12.7%. And many low-income Ohioans were affected when housing, Medicaid, and the Supplemental Nutrition Assistance Program, or SNAP, benefits offered during the pandemic stopped. The report was prepared for the Ohio Association of Community Action Agencies, which work with low-income people to get them to self-sufficiency. It's headed by Phil Cole, who has thoughts on what the definition of being in poverty really means.
You know, there are so many ways to look at poverty. There's a federal definition, federal poverty guidelines, which are very, very flawed, but they're the ones used by most people. You know, we like to use the self-sufficiency standard, which is the income you need to get by without private or public help. You know? And then there are supplemental systems, that kind of thing. But the most important one that people use is federal poverty guidelines, which that sets the eligibility standards for most federal programs. We just go with self-sufficiency standard because we just think that's the one that really tells you the truth.
Tell me a little bit more about that. What does that actually mean? And can you put is there a dollar figure you can put on that?
Yes and no. In Ohio, we have a self-sufficiency standard. You can find it on our website at owaca.org. But we do it by 7 different family sizes, you know, and we do it based on cost of living for different things that are different necessities. And we also do it by tax rates and those kind of things for every county in Ohio. So yeah, we can do it. We can do a number, but there are hundreds of them, because we say this is what it is if you live in Cleveland, this is what it is if you live in Gloucester. You know?
And there are different factors that come into play here. You look at costs for health care and food and that sort of thing.
Healthcare, food, housing, what tax rate would you pay, and do you get tax credits? We count that back in as a plus. You know, what's the cost of childcare? And the amazing thing is, no matter where you go in Ohio, if you have children, the highest cost that you will pay will be childcare. People don't understand that. We try and tell people, especially young people, you have to understand that children are great, but they cost you a lot of money. You know?
Some safety net changes from the pandemic have ended, such as boosts in SNAP or food stamp benefits, the suspension of work requirements for Medicaid. Are those why the poverty level went up, or have you not seen the effect of those changes?
We're just seeing the effects of those changes now. And they are things that scare me. I talked a little bit earlier today about how we're having the Ohio University evaluate the program that we ran on rent assistance, asking to look at how Department of Development administered it and how we ran it. And we'll have the findings out later this summer. But I saw the preliminary findings, and one thing that shocked me was they did surveys of our customers, and one of them was so scared of losing rent assistance because she hasn't recovered from other things caused by the pandemic, that she said she would consider suicide over homelessness. And we have to remember the very human factors that are to play, that are affected by COVID. And it scares me. We tend to get caught up in these temporary programs that we had for COVID, and we see them as dollars. And we say, okay, the president declared COVID to be over, so COVID's over. Everybody go back to normal. Well, there is no normal anymore. The normal of 2019 is not the normal of 2023, and many people have not been able to cover the costs or cover the losses they had from the loss of jobs and those kind of things.
You cite 3 areas of focus in this report, and I want to ask you about each and how they affect poverty. Let's start with pandemic learning loss. How does that affect people in poverty?
Well, first, the problem that we saw first was when the governor had to close the schools, and he did. It was the right thing to do. And he worked as hard as he could to get them open as fast as he could. But all the time that they were closed, students were supposed to work remotely, of course. The problem was poor students, and many students just in Appalachia because of the geography, didn't have computers at home, and they could not link to the internet because of the geography of Appalachia. You also had that same problem in rural Ohio, other parts of rural Ohio. And then, of course, urban Ohio, it's very expensive. But so students were affected by the fact they didn't have computers and the fact they didn't have internet. And they're supposed to work remotely, but they didn't have the tools. So that was part of it. Another part was schools provide free meals. Those meals were gone. If the schools were closed, they were gone. Some places, we worked very closely with Children's Hunger Alliance to try and replace as many of those meals as possible, but we didn't have the resources. We couldn't do all of it, we did a lot. So.
And there is a connection between poverty rates and schools. I mean, they're schools that are in wealthier neighborhoods tend to have better test scores and that sort of thing. There's an economically disadvantaged thing about this.
Oh yeah, we saw the test scores went down about 13% in urban high poverty urban areas and about 3% in suburbs. Suburbs tend to have people who are more highly educated, and they tend to be wealthier. So they have the computers, they have the broadband, and it's a real important item to them. So,
one of the other areas of focus in this report was mental health. How does that affect people in poverty?
Mental health, it's very difficult emotionally to be poor because you're fighting to get by. You're always under stress, and then when you lose your job because of COVID, that makes it a whole lot worse. And if you need counseling, mental health counseling, a quarter of Ohio's counties don't have a mental health provider that's certified, registered with Medicaid. And so it's hard. And then when you have the transportation problem we talk about, and if you're one of those rural counties that doesn't have a counselor for it, you've got to travel someplace else. But if you have the transportation problem, you can't get there. So these things just compound, and they make matters a whole lot worse. The stress got a lot worse for people in poverty, and the help was farther away.
And on that note, transportation, that's another area of focus. How does that affect people in poverty?
They have to be able to get to their job. We don't have good public transportation. We talked about that earlier today, where the average state per capita spends $60 a person for each of their citizens. It's 60 per person. Ohio spends $6, basically nothing. So there's not good public transportation, especially if you live in rural areas. A large percentage of people in this state live in one county but work in another, and if you don't have a car, you're in trouble. Cars are expensive, car repairs are expensive. If you're poor, it's harder to afford those things.
Are people poor because of the choices that they make? Because that's quite often what we hear, is that if people made better choices, they would not be in poverty.
Sometimes that's true. I would say it's more that society makes bad choices. We're not funding these schools. The Dorolf decision that said we were not funding constitutionally was 30 years ago. And in this budget, they made some real progress towards funding them properly. We left an entire generation behind. Like I said, we haven't funded public transportation. We need to fund public transportation. Those are society decisions. We need to encourage more people to get into mental health careers, and then give them incentives to go into these areas where they're needed. We always want to get people into these jobs that are in high demand. Mental health care in rural areas is in high demand. Let's do something about that.
You mentioned that there is funding in this budget. In fact, the budget went back to the House's funding, which was $500 million more than the Senate's funding for traditional K-12 public schools. Is there anything else in the budget that you really feel will help people in poverty?
Oh yeah, there's the $793 million they put in for broadband. That's going to be a big deal. That's really going to help students especially. I wish they had more for public transportation, but I say that every year. So, yeah.
When you start talking about the things that could be done to help people in poverty, you've said that there are societal choices that are being made that help keep people in poverty. Are you fighting against an attitude that says people need to make better choices rather than we need to pay for this stuff?
Yes. Yes, we are. But I think it's not that hard to figure out. If you look at the fact that we don't have public transportation, we don't have good mental health care, we don't have affordable housing, our health care is through the roof. We spend, I think we're 4th or 6th in Medicaid funding now. We need to take a real look at these issues. We need better public policy.
And poverty, in your report, you describe it as not just it can be episodic, it can be occasional, it can be chronic, it can be even generational. I mean, poverty has a lot of different definitions, so to speak.
Right. Episodic poverty is what we're seeing a lot more of now. Well, let me bore your audience with a couple of definitions. Chronic poverty is you're in poverty for 2 years during a 24-month period. You're in poverty for 24-month period, we call it, otherwise known as 2 years. Episodic poverty is 2 months out of that 24, 2 consecutive months out of that 24-month period. We've seen a lot of episodic poverty because of COVID. That's people going in and out of poverty. They get a job, you know, and all of a sudden they lose a benefit for something else, or they're able to pay their rent because of rent assistance, and the rent assistance disappears. We have a very inconsistent system that causes episodic poverty. Chronic poverty is a lot of times it's generational stuff. It's people who just can't get going, and there's some debate about is that personal decisions or society decisions. I say it's some of both, but I tend to lean towards more towards society.
And if people are in episodic poverty more often, will they end up in chronic poverty, or can things turn around and they can end up out of poverty?
Either. We really hope that they turn around, we hope that they come to community action and let us help them find out what the problem is and what do they really need. You know, we don't want to just say, okay, we'll give you some. You should go over to the Department of Job and Family Services and get food stamps. And we need to say, why are you here? Do you need child care? Can we help you get that? Do you need a job? Can we help you get training? We have to find those answers. Look for the real solutions for this episodic poverty.
The new state budget caps subsidized child care at 145% of the federal poverty level, which is about $35,000 a year for a family of 3. And a provision from the Senate budget was removed that would have required a photo on SNAP cards. Supporters have long said it's a fraud-fighting effort for food stamps, but advocates have said it would cost the state more to administer than it would save and would be a serious problem for families using those benefits.